Millions of people have used the 988 Suicide and Crisis Lifeline. But according to a new study, most who have say they wouldn't do it again.
Yeah, the study's lead researcher says that the data shouldn't mean that the service is a failure, but that it could use some tweaking to get it right.
Joining us now to take a deeper look into this survey is Dr. Gerald Shiner, a psychiatrist, also an associate professor at Wayne State University. Thanks for joining us today.
Thank you.
So in terms of this hotline and how some people are responding to it, why do you think that we are seeing that kind of response?
Well, this is a new service, and it's staffed by volunteers and paid workers also. I think it takes a while to get this tweaked and figured out. I think people who call may not know what to expect, and what you're going to get is not a psychotherapy session, but you will get someone who's understanding, who should listen to what your desperation is about or what your difficulty is about, and then help you find help in your area, give you a referral, and try to be encouraging. And the important message is that you're not alone. People go through this, help is available, and things aren't as bad as they seem, and if you get help, you can find a way to see it that way. Now, when people say they won't call back again, clearly it's a question of them not getting what they expected they would receive when they first received it and when they first used the service.
Yeah, we know someone who wouldn't call back again. One of our producers here actually did call before on behalf of a friend or a loved one and had a terrible experience. He even said the person on the phone yelled at him for not sharing personal information about the friend he was calling about, and even told him that it would be his fault if she died by suicide. I mean, what goes through your mind when you hear that kind of experience?
Well, that goes against every rule that we learn, or every rule that
Right.
I teach when I train psychiatrists, because if you're calling on behalf of someone else, first of all, the person who you're talking to should realize that you're on the spot. You're in the middle of someone who's in distress and someone who might be able to help, and you can't disclose that person's name. It's very unprofessional, almost unethical for you to tell me, well, he's suicidal, why don't you call him? And I call you up and say, well, someone told me you were suicidal.
A breach of trust.
That is a breach of trust, confidentiality, and privilege, and it's intrusive because someone has to reach out themselves. And if you call and say, I have a friend who's in desperate need, this is what you do. This is how you approach it. This is how you listen. This is the question you ask, and this is the advice that you give, and this is the place that you go. That's the most important part, and that makes it constructive. So that shows that they do have a few kinks. They have to really tweak this, and they rolled out a national service, and you can only imagine what it's like to have the whole nation calling, especially as we approach the holidays, especially as we have financial issues, as we have issues in the world with wars and people being hurt and killed. So that does disturb people. And if people ask for help, you have to give them a direction, you have to give them hope. You can't say, look, you have to do this, you have to tell me this, and if you don't, it'll be your fault or something. That's terrible.
Yeah.
And those can be critical moments when someone does reach out and uses that line. How crucial is it that we have the right people in place who at least know what to say or how to get you to the help that you need?
That's so very important. And if someone is so desperate and so alone that they can't approach a friend, that they can't ask for help, and then they want someplace that, and I think what makes the service easy is that there's a little bit of anonymity, and you can call and you say, look, I'm feeling terrible, what can I do? And that person has to be neutral, they have to be interested, they have to listen rather than to tell. And the psychiatrist's job is to listen and understand and tell me, what are you going through? How do you think we can help you? What are you looking for? Where do you live? And if you live in this area, this is where you call. Now, the other resources are your local hospital, your primary care doctor, a university. You know, you can. I have really 3 settings. I have a private practice, but I work for Wayne State University, and if you call the Department of Psychiatry at Wayne State University, we will help you find the right direction. We have a practice plan called Wayne Health that has psychotherapy services. I work at the Detroit Medical Center. I'm the chief of psychiatry at Sinai Grace. If you call us, we have an emergency clinic in our emergency room where you can be seen. So there are ways that you can reach out for those resources, and the national hotline should have those local resources available.
All right, so the takeaway here, there are plenty of resources if that one is not the one that's helpful.
And what you're asking for is resources. Where can I go for help in my area?
Absolutely.
Not can you be my psychiatrist over the phone on an 800 number when I don't know you and you don't know
Right.
me.
All
Yes.
right. Well, we appreciate your time so much. This is Dr. Gerald Shiner from Wayne State University, as well as a psychiatrist. Thanks so much for joining us today.
Thank you.
Appreciate it.